So my name's Diane Riccardi, and I'm one of the dietitians at Moffitt Cancer Center. I've been here for 25 years, so I've seen quite a few buildings go up, including the one that we're in right now. And as you know, we're trying to expand out and get closer to you all so you don't have to make such a long drive to get your treatments. It's my pleasure to talk to everyone today, and the questions that I've heard so far are just I've just been amazed at how educated our patients have become about their disease and looking for clinical trials. And we do the same thing with nutrition. We're always looking to expand and see what we can do better. So today I'm going to talk about how nutrition plays a role in your kidney cancer treatment. So a dietitian can be very helpful across the cancer care continuum. And of course, Moffitt has a very strong prevention program too, but we're going to today focus more on how the dietitian works and along with the team in helping patients through their treatment. Mostly what we're doing is we're helping patients stay nourished and manage their side effects by changing diet, making some dietary changes. But the dietitian is also vital in survivorship roles. So for early stages of kidney cancer, for people who've had a nephrectomy or have one solitary kidney, the question is always, how do I keep that kidney healthy, especially if I have high blood pressure or diabetes, etc. And dietitians can be very helpful in that setting also. So let's kind of start with nutrition support during treatment, because many of you are still on some treatments if you have advanced stage cancers. So the most important thing is staying nourished through your treatment. So we know that as you're nourished, that it really allows you to better tolerate your treatments, right? If you get very undernourished or if you get very dehydrated, your treatments might get delayed or put on hold. They might be changed if there are just too many side effects that we're not able to manage because it's really interfering with your quality of life. Ideally, you are not going to change your diet too much when you're first diagnosed with kidney cancer. Many people do that because they go online and they start reading about renal diets and other types of things. So they start coming in already changing their diet. But we really want you to limit your diet restrictions in the beginning, because restricting your diet can restrict your nutrition. And you may not be getting all the nutrients you need, which you're going to need to go through treatment. So, for example, if you eat a diet that's too low in carbohydrates, you can start breaking down muscle to be used for calories. So that's very important that you're getting adequate calories. And sometimes we have to focus on that because people will come in and say, well, the average American is overweight. So of course people will come in and say, well, I can lose a few pounds. That won't be a problem. And I'll say, well, let me tell you a little bit about if you lose your lean muscle, especially if you're losing weight quickly, that can interfere with your immune system, and it will also interfere with your response to therapy. So it's very important that you stay nourished during your treatment. The other thing dietitians do is they help manage side effects from some of these treatments, and you hear about the side effects, you're experiencing those side effects. And the nurses are wonderful, and they're here to help you, and you've already heard some nutrition suggestions on how to manage those side effects today. So I always say that the dietitian's job is to help manage the side effects, but still help you really enjoy what it is you're eating. So these are just a few of the side effects. Now, if you're a Moffitt patient, you have access to a dietitian. All you need to do is speak to your team and ask them to make a referral to you for a dietitian. We do consults in telemedicine, we do consults in person. So whatever is most convenient for you. As far as your side effects are concerned, if you're having nausea, you're going to start making some changes to your diet. But if you're finding that those changes really aren't improving your intake and you're losing weight, you may have a referral to a dietitian who can make some suggestions for you. So for example, you may know, well, I'm supposed to eat small frequent meals, but I'm too tired to cook 5 meals a day. The dietitian comes in and says, you only have to cook 3 meals a day. Just eat half at a time. So sometimes those little suggestions can really help improve your intake. Diarrhea is another side effect. And what I want to kind of focus on here is every time someone has diarrhea, it's very hard to stay hydrated. They get dehydrated, they get nauseous. So you can get other types of side effects, and they kind of build and it makes the treatment really, really difficult for you. So every time you have a loose stool, I always tell people, take a drink of water after that. Like right away, kind of a water chaser, just to help stay hydrated. The other thing is there are 2 types of fibers. So you hear, well, a low fiber diet. There are soluble fibers and there are insoluble fibers. So soluble fibers are like bananas, applesauce, some of the things you saw on the slide earlier. Those are soluble. They're like little sponges. So when they get in your gut, they help absorb water. So they can reduce diarrhea that way. The insoluble fibers are things like the skins on fruit or the skin on a baked potato or the stem on a broccoli. Those go through like Brillo pads. So if you're having diarrhea, those are going to go through pretty quickly and you're going to get some gas and bloating from that. Obviously, smaller portions people do better with. Taste changes is a big thing. When I have someone comes in and they say they have no appetite, I'll get a consult, poor appetite. And I find out, it takes a little detective work, but you find out the reason why I don't have an appetite is because nothing tastes good. And you know, if you've raised children, that if you try to get a child or a baby to eat something that doesn't taste good, they're not going to be eating. So it's the same thing if you're experiencing taste changes, and if you're leaving out some major food groups, there are a lot of little tricks that we can do. So not only using herbs, but moist foods taste different than dry foods. Cold foods taste different than hot foods. So what I usually do is I usually say to someone, what does taste good? And we start with that. So if they say fresh fruit, then I say, great, let's have some chicken salad like Alessi did here, and let's put some grapes and mandarin oranges in it. Then that chicken salad's really going to taste good and you're going to be able to get down protein. Now, if you don't have access to a dietitian, there are a couple handouts that are outside, and one of them you see here, the eating hints. So that does go through different side effects and different types of, changes that you can make in your diet. So that's very helpful. Okay, now let's talk about a little bit more about survivorship. Say you're managing your side effects well, but of course you want to know, how do I keep this kidney healthy? Okay, so all these things are important for kidney health. So controlling your blood pressure is very important. Managing your blood sugars, avoiding smoking, maintaining a healthy weight, and staying physically active. So dietitians can really help in all of these things. So for example, managing blood sugars. If your blood sugars are high, that makes your vessels sticky. And if your vessels are sticky, then the vessels that go through the very vascular kidney are also getting sticky, and they can become occluded. And it can be harder for your kidney to do its job of filtering. So getting blood sugars under control are really important. Blood pressure, if your blood pressure is high, then that can cause hyperfiltration. That can make your kidney work too hard. And we really want to get that blood pressure under control. Smoking, the same thing, it can affect the vessels. Maintaining a healthy weight, so as you probably know that being overweight is a risk factor you saw for kidney cancer. So it's important to maintain a healthy weight. So trying to lose some body fat, but still not be too lean, so not be underweight, but trying to lose some additional body fat is going to make it easier for your kidney to work. And of course, physical activity. Okay, so you're hearing about how important the kidney is and that it regulates, it's mainly your main filtration organ. So if the kidney is playing this crucial role in filtering, what's it filtering? So these are some of the things that it's filtering. And as you can imagine, we're basically getting these things from our diet. So our bodies can't make potassium. We have to get it from our diet. So vitamin D we get from the sun, but the kidney converts it to its active form. So the kidney is very important in kind of regulating all these things. Protein, the metabolites of protein are regulated by the kidney. Sodium and potassium are your electrolytes. Phosphorus and calcium are your minerals. So these are just a few of the things that the kidney is very important in regulating and that we get from our diet. So how to support your kidney? Basically, stay well hydrated. So the main thing would be, for most people, even if they have some kidney dysfunction, if it's a very mild kidney dysfunction, Staying hydrated, getting enough liquids is very important. Only if your doctor said that you need to restrict your fluids, should you be restricting your fluids. Otherwise, you should be keeping those kidneys nice and flushed, because if their job is to filter, they need water to be able to do it. Limiting salt in the diet is another way of kind of helping the kidneys work a little bit easier. And that's not easy to do in America, because in America, the code for seasoned is salt, which it isn't in some European countries. Eating more plant-based diet, we're going to talk a little bit more about that, but it looks like the evidence is saying that plant-based proteins are easier on the kidney than animal-based proteins. So if we're getting our proteins from nuts and seeds and beans, that's easier for the kidney to metabolize than if we're getting it from meats. And then limiting ultra-processed foods, and I'm going to show you some evidence showing that can contribute to kidney disease. So what is enough fluids? So the dietitians and doctors will do some calculations using your weight in kilograms, but the easiest thing I think for you to do is to take your weight. So say you weigh 140 pounds and you divide it by 2, so you would need 70 ounces a day. And that's usually going to be a little more than 2 liters. So kind of that rule of thumb, like 8 cups a day, doesn't really apply to everyone, but it's a starting point. Men actually need a little bit more water than women, and that's because men have more muscle than women do. So men just naturally have more muscle, and where there's muscle, there's water, so they need more water than we do. But you can also get fluids from water-rich foods. So, and I'll show you some examples, but water-rich foods can provide up to 2 cups of fluid a day for us. Okay. How to stay hydrated. So this is where I say where the dietitian comes in. You know what you need to do, right? How do you do it? So here's the dietitian trying to make things easier for you. So what some people will do is they will front load their hydration. So what you do, you start off in the morning, right, with the best intentions. I'm going to get this done. I'm going to eat healthy today. So sometimes kind of getting up and getting that 12 or 16 ounce, if it's a water bottle in, and you can kind of front load. Set a sip strategy. Say you feel nauseous from your treatment, and drinking a glass of water is just not going to do it. You're going to want to kind of sip on something throughout the day. And they have these really fun water bottles that if you don't pick them up like every 15 or 20 minutes, they start lighting up. And we have some of our admins have them on their desk, and you'll see it lighting. It's like you're supposed to be drinking, So people have their watches tell them, their smart apps, they're all kinds of things. We talked about water-rich foods. These are some examples of water-rich foods. How do you know if you have a water-rich food? Well, if you take a bite into it and it's dripping down your arm, you definitely have a water-rich food. We were just in Seattle, and I said, "What's sweet today?" He said, "A nectarine," and I needed like 4 napkins to be able to eat it and get around. Infuse it or cool it. That means get fancy and make spa water. So you can put some fruit in it and make it a little bit fancy, because people get tired of drinking just water. And then kind of watching for signs of dehydration. So, and I'm sure your doctor goes over these things with you, but when you go to the bathroom, your urine should be kind of a straw colored. Maybe in the morning it's dark, because hopefully you've slept most of the night without having to go to the bathroom. But throughout the course of the day, the urine should be getting lighter and be more of a straw colored, so that you're hydrated. Okay, what to drink? Okay, so obviously mostly water. That's what we're giving you mostly today. Fruit juice is an option. People are concerned sometimes about the sugar. So if you have diabetes, a lot of times your dietitian's like, "Oh, I'd rather you have an orange than orange juice." That's for a low blood sugar. So what you can do with fruit juice is you can kind of put a splash, if you wanted to, in your water, just to kind of give it a little bit of flavor. You can put fruit in it. There are unsweetened sparkling waters, and you could do like more decaf or caffeine-free types of teas or sodas or coffees. Limiting sweetened beverages, energy drinks. Electrolyte drinks are good if you're having diarrhea, but if you're not, you may not need that extra sodium and potassium that's in there. Alcohol also can be dehydrating to a certain degree. Caffeine drinks, if you're drinking more than 2 cups a day. So these are just kind of some examples of kind of what some of the best things to drink are. There are some studies that very interesting studies. They were cohort studies, so they were large groups of people, and it showed that consuming sugar-sweetened beverages or artificially sweetened beverages can really contribute to chronic kidney disease. So unsweetened beverages artificially sweetened beverages aren't necessarily a replacement for. So if you're doing Pepsi, automatically going to a Diet Pepsi may not be the option that you want to switch to. Okay, choosing mostly plant proteins. So how do you do this basically? You want to try things like whole grains and beans and legumes and nut seeds. These types of things are all kind of plant proteins. There are meat alternatives. They're pretty popular that are out there. You just want to check the salt content because they are highly processed. So some of them can be very high in sodium. And if you're trying to watch your sodium intake, you might find that Impossible meat has a lot more sodium than your hamburger would have. So this is just a way of making it easier for your kidney to digest the foods that you're providing. This is an example of a protein flip and what we could do. So this is just a classic chicken marsala where you'll have the chicken breast and then you'll have your pasta and you might have some mushrooms or something in there. So by doing a protein flip, we're basically doing more mushrooms and less chicken. And then here we actually took the pasta and we changed it into quinoa to try to give you a little bit more of a whole grain. And then we added some color by putting some spinach in there. So it looks just as delicious, but it doesn't have as much animal protein. And that's why we call these protein flips. Okay, another really simple way to eat more plants is to put more plants on your plate. So the typical American diet, usually when you go out to order your meal, you start with your entree. So you decide, am I having chicken, fish, beef, etc. And then they say, and what sides would you like? So they're implying that the main source is going to be on half the plate. That's going to be the star of the plate. So all we're suggesting is that if we make half the plate your fruits or vegetables, so if you order double vegetables, and then your protein and your starch are 1/4 each. So now you're looking at a plate that definitely has more plants, but it's still a plate that's full, and it's still a plate that's colorful, and it's still a plate that's delicious. So how do you do this? You basically go slow. So we start with, I grew up definitely with things like, a steak and peas and mashed potatoes, and then you kind of move it a little bit more slowly. So we took the peas out because they were a little starchy. We put some green beans in. You saw that steak got a little bit smaller. And now we said, I'm really going to get excited here and I'm going to put some reds in there and some yellows in there. So you can see I can make an absolutely delicious plate that's really mostly plants. Okay, salt. So the average as you can imagine, the average American diet is too high in salt. There is salt in a lot of foods. It's hidden in a lot of foods. It's in a lot of processed foods. So the recommendation for everyone is 1,500 to 2,400 milligrams a day. But there are a lot of claims on food labels. So sometimes when you're looking at food labels, it's a bit confusing. I will often have to turn the package around so I can find this nutrition facts label. So if you've ever gone to the grocery store and you've seen the food packages like turned around, then you know a dietitian has been there. So the dietitian really feels like that nutrition facts label should be on the front, and don't believe anything else that you read. So when you look at your nutrition facts list, so you can look at all these things, sodium-free, very low sodium, sometimes they never had sodium and they say it. So you can see all those things on the front and you can memorize what all those things need, or you can do what the dietitian does and you can just turn that package around, look at the nutrition facts label. There's always sodium listed on the label. It's been there forever. And if you look over at the percent daily value, if you're looking at something that's 20% or more, that's going to be a high salt item. If you're looking at something that's 5%, this particular item 7%, that's going to be something that's lower in sodium, a little bit healthier for your kidney. The most important thing is to look at the serving size, because you know the bags of chips and things that we give out, those aren't always one serving. So if you're eating the entire bag might be 2 servings, so you would kind of have to double that sodium value in there. So important to look at the nutrition facts label and the serving size. Okay, so here's a little practical tip. So this is a homemade soup that we made we were doing a survivorship group with breast cancer patients, and we were doing a teaching kitchen. So we were in our kitchens, they were in our kitchens, all of us were on Zoom, we were all making the same recipe. So this is a colorful lentil soup that we were making. If you make homemade soups, obviously they're much lower in sodium and they're delicious. So learning to cook at home, it's really very interesting how many of us don't. Limiting ultra-processed foods, because that's really a way where you're going to get a lot of salt and added ingredients. Reading the food labels, we talked about that. Some people will say shop the perimeter of the store, right? Because the processed foods are on the inside, but so are the herbs. So I don't completely do that, but you can try doing that. Using things in place of salt, there are a lot of examples. Kind of unsalt your snacks. So if you're having snacks, you're looking for kind of low sodium things. And then be cautious about salt substitutes. If your doctor said your potassium is a little bit high, you want to be careful of something called a salt substitute. So I had someone using salt substitute because they knew they needed to eat less salt. And the substitute, instead of sodium chloride, it was potassium chloride. So it was a very high dose of potassium that they didn't realize that they were getting just from that salt substitute, because they were kind of looking for that bite. And you can get that same kind of salt bite if you use like vinegar or lemon juice. Sometimes you can still get, or some sort of spicy pepper, but you're looking for flavor, and salt does give foods flavor. So you're going to have to be creative about finding things that taste good. Here's your ultra-processed foods. So I grew up on both these foods. So you know both these crackers are sold in this, they're right next to each other in the grocery store. They both come low sodium. So the Ritz cracker, Ritz is called like a hint or something. It's got a little bit of a different name for their low sodium. And the Triscuit also comes low sodium. So okay, you're like, okay, this is great. Both these products are low in salt. These are low salt crackers. If you look down at the ingredient list for the Triscuit, so the Triscuit has 3 ingredients in it: whole grains, canola oil, and sea salt. So those are 3 ingredients. If you look at the ingredients in the Ritz crackers, there's a lot more. So you can see the Ritz crackers, which are sold on the same shelf as the Triscuits and are bought almost as often, are a lot more processed and have a lot more, are ultra processed. And what we know is that people who consume high ultra processed foods had a 24% higher chance of developing kidney disease. So very important to try to bring down the processing. There's an app which is super fun. It's called Yuka. Y-U-K-A. It's a free app, and you can scan the barcode on the product and it will tell you how much processing, and you can also use it for things like cosmetics and other things if you want to see what's in your products that you're putting on your face. Now we're just going to end with 2 very common questions that we get. Do I need to be on a renal diet? So there's a little bit of confusion. I can understand that, because if you have renal cancer, you're thinking maybe I should be on a renal diet. But a renal diet is really for someone who has kidney dysfunction. Now, sometimes with kidney cancer, there is some kidney dysfunction. You have a nephrologist and they're talking to you about these things. But if that's not the case, you do not need to be on a renal diet. And a renal diet is very complicated. And I'll tell you, when I did my internship and you had to rotate through the different departments when I was in Boston, I ended up on the kidney and the dialysis unit for like 4 weeks. And I sweated it out. There were 12-hour days. I was exhausted. And at the end of it, my internship director says, "Why did you spend 4 weeks on the kidney unit?" And I said, "Well, because you put me there." And she goes, "Oh, that was a mistake." Well, I'll tell you, after that, I said, just give me that kidney diet anytime. I was not afraid of it. But what you can and cannot eat really depends on your kidney function. So only if your doctor says you need to restrict something other than salt, then there is really no reason to be restricting other foods. Okay, we get this a lot. Does sugar feed cancer? So no single food can prevent or cause cancer, including sugar. So sugar as causing cancer or feeding cancer is a little more nuanced. So there's no data that says if you eat 2 cookies that you're going to grow 2 kidney cells, 2 kidney cancer cells. So it's not like that. It's more eating a diet that has a lot of sugar over time, maybe gaining weight, having high insulin levels. And then cancer cells can have things like insulin, like growth factors, that can kind of stimulate the growth. So certainly no dietitian is going to come in and tell you you should drinking sodas and having all this added sugar. But we don't want people cutting out a lot of carbs in their diet or cutting out like fruits and things like that have all these other benefits like fiber and vitamin C. Okay, well, thank you so much. I really appreciated being here.